For patients who, despite having excellent skin elasticity, are troubled by severe dark circles exclusively under their eyes. Looking at the photos, a complex combination of issues, not only deep tear troughs but also excess sagging skin, darkens the overall impression. This is why we excise the skin and muscle as shown, while concurrently performing a lateral canthopexy. We had a patient who, despite having excellent skin elasticity, was troubled by severe dark circles exclusively under her eyes. Looking at the photos, a complex combination of issues, not only deep tear troughs but also excess sagging skin, darkens her overall impression. Therefore, we excise the skin and muscle as shown, while concurrently performing a lateral canthopexy. Using an incision similar to that of a standard lower blepharoplasty, we combined muscle treatment with lateral canthopexy. Fat repositioning is the foundation of this procedure. It is a comprehensive surgical method that brightens the tone of dark circles, almost as if applying concealer. While some patients hesitate to undergo an incision due to concerns about scarring, proceeding with surgery while leaving excess sagging skin behind will ultimately lead to suboptimal results and dissatisfaction later on. Whether smiling or remaining expressionless, the skin will bunch up and wrinkle. This can create the impression of a lack of firmness around the eyes. Can you spot the scar now? It is barely noticeable. For those concerned about scarring from lower eyelid surgery, such worries are unnecessary when the procedure is performed with highly precise surgical techniques. A significant number of patients regret their results later due to excess skin when existing sagging is not properly addressed. Even these fine wrinkles, bunched up skin that appear when smiling would have remained in substantial amounts had they not been excised. Even if the bulging fat itself is flattened, leaving the skin sagging will ultimately result in an incomplete and unsatisfactory outcome. The same is true from a 45-degree angle. Please take a look at this video. As you can see, the scar is virtually invisible to the naked eye. For patients with sagging skin, a truly satisfying and perfect result cannot be achieved unless this is also addressed simultaneously. This is because it is a complex issue involving multiple interconnected factors.